when we talk about austerity, we are talking about public sector, not private sector. And private debt is very different than public debt. So because government is not a profit-making entity, government's job is to deliver services. So in such a situation, if we are talking about government reducing itself to have a controlled regime of deficit and debt, that is important for the private sector investment and growth, I understand that, but it can have detrimental effects when the economy is in recession. But I agree to the fact which Jayanto was mentioning, that where is the money. So even if you want to be a Keynesian, you really cannot become a Keynesian, because there is very little money left in the Western world,
unless you create bigger deficits.
Yeah, unless you bring down your deficit. So that's why even in Greece, when after the new election, they are renegotiating the austerity measures, even though there is a austerity vote. So I think some of the provisions of austerity are draconian, and that can have serious impact on health spending, on education spending, spending on social securities. So I think balance will have to be ensured. So how much of the government you want to contract for the provision of growth, and how much of the growth would come because of the spending of this. The effect could not be immediate. So if you today spend on education, tomorrow your growth doesn't increase. But there is a long-term growth dividend if you are spending on health, if you are spending on education, if you are spending on social security. I think that is where we stand. And in that case, probably Europe has a better chance of austerity rather than countries like ours, because they already have achieved much of this. But they need to keep that pace. So it's a delicate balance between growth and austerity one has to see. So if we say that austerity will bring in immediately growth, I'm not too sure.
We need to take a quick commercial break. There's a lot more to discuss. Do stay with us.
For a happy and productive life, one needs peace of mind. That is why I chose LIC. LIC adds some magical notes of security to life. Then why go anywhere else?
Welcome back. Well, Mr. Chaudhary, but you know, this whole growth versus austerity debate is also brought into India, and this point from there, what is being talked about is that we need to cut our subsidies. Is that possible when we're talking about inclusive growth? We have, you know, a huge chunk of our population which is dependent on it. And we can understand in the political situation that we are in, and the nature of our plurality in our politics, it's difficult to take decisions to end subsidies.
Well, those are two different things. The nature of our politics and the need to cut subsidies, or rather retarget subsidies. You can't say cut subsidies, because ultimately some of it actually will, you find that your subsidy bill is actually increased in trying to retarget subsidy. What you need to do is, definitely you need to retarget subsidies. Is the fertilizer subsidy really reaching the farmers? That's one question you have to ask. Secondly, is it really good for the farming sector as a whole? Obviously, if you give a lot of subsidy to urea, farmers will use a lot of urea, and which is what has happened, and which has had devastating effect on large swaths of farmers in northern India, which have lost fertility. Now, you need to do something about it. Obviously, you need to retarget the fertilizer subsidy in such a way that it actually does benefit farmers rather than fertilizer companies who have been known to have gold-plated their results, you know, their production, etc., etc. A lot of things that they have done to make money.
Besides fertilizer subsidy?
Besides fertilizer subsidy, if you take into account diesel subsidy, how much of it is actually benefiting the consumer, end consumer, who is supposed to have been subsidized through diesel subsidy? These are questions which you have to ask. These are hard questions, and you need to address those questions. Certainly, you need to reduce the subsidy levels in some ways or the other. But at the same time, you have actually done very little in providing social security in this country, unlike Europe or United States of America. And you are now progressing towards that. Food subsidy, the whole question of giving some kind of right to food, you know, is linked to that. The whole question of some kind of a Medicare insurance for the rural population, which is now being talked about, that is again linked to that. Now, these are new expenses which were not there earlier in the budget. You will have to bring them in, and at the same time you want to cut down certain older subsidies which you feel have either outlived or are not being properly spent. In the balance, you might actually end up spending more on subsidies. But that might not be such a bad thing to do. You are, as Professor Chakrabarti pointed out, you have to spend some money in order to have a better workforce, in order to release certain energies in your country.
Okay. Professor Chakrabarti, if we take what the Prime Minister said at G20, he said that why don't you people invest in our infrastructure, or the developed world invest in the developing world's infrastructure. You had already said in your previous answer that, a lot of infrastructure is already in place in these countries, especially in terms of social security and these kind of issues. Is there a possibility, even in the financial infrastructure sector in terms of insurance and things like that, where, we can learn a great deal from the West?
I think it is very important to understand that one of the modes of financing health, everybody is talking about insurance. I think in the West, if we look at, there is a great public health infrastructure simultaneously in place to provide this insurance. We really do not have that. Right. So this insurance cover and the marketing for insurance profit, how it is going to play out when you don't have a sufficient health infrastructure, whether in the public and private sector, and how it is going to benefit the poor, I am really not too certain about that. So I think it is very important, if we want to provide insurance in the remotest corner of the country, say in Arunachal Pradesh, whether insurance will reach and that person will get the quality of healthcare that you get in probably in All India Institute of Medical Science is a real question. So I am not too sure. So I think it is critically important for the government to make spending on health, and I'm glad if we look at the budget for the last, say, 7 to 8 years, you will see central government has not been making great deal of spending on capital infrastructure. The most of the spending are on big ticket centrally sponsored scheme, right, which are also in health sectors. So I think a lot of social sector spending in education and health is already happening, right, and that is important to happen. But if we are talking about insurance, if you think that proper insurance market will develop and that is going to benefit the poor, I think supporting infrastructure in terms of regulations, because there are private insurers, will have to come in before real benefit of insurance reaches to the poor. And I think we have to work this path really deeply.
Right. And also in terms of green technology, first of all, structure, not skill infrastructure, building ports and roads, etc. There's so much more that can be done. Would you think that we are looking at a long gestation period, but it would help the global economy, kickstart again?
Obviously, I mean, physical infrastructure is the need of the hour. I mean, we need it desperately.
It's needed in all developing countries.
In fact, even when the government of India was talking about austerity measures, about cutting down on whatever it was, small little things like fees, flying first class or whatever, at the same time talking about monitoring big ticket infrastructure sector spending, ports, airports. One of the first meetings the Prime Minister took after the S&P rating outlook came out was on the infrastructure sector. It's disappointing that that meeting really did not yield much, excepting some, targets about when they would announce this sector or whatever it was. There was not real great message coming out of that meeting. But the point is, the Prime Minister did hold a meeting on that because he realizes that if you can actually do the spending, very unfortunately, many years we end up not spending on the big ticket infrastructure projects. Right. To the that we have budgeted for. So you need to actually spend on those dams and on those roads and on those ports and airports, whether in the public sector or in the private sector. Much of it has to be in the public sector because these are long gestation projects, and the private sector is not going to spend money. No private sector large port has come up in India. They have all been very small ports. Right. If you want to set up a large port, and that is the need of the hour, you have to do it in the public sector.
So if it has to be done in the public sector, but they're also talking about public-private partnership, Professor Chakrabarti, to attract that kind of investment from abroad, because that's what the Prime Minister has been talking for a very long time now. I mean, this huge amount of investment, $1 trillion it was to start with, but it's gone up in infrastructure over the next 5 years. Are we creating the right environment for it?
Well, if we look at the past experience of our PPP, I think we have some examples of very successful PPPs running in this country. But if we look at the PPP distribution as an investment is very skewed. it's happening where? It's happening in Delhi, it's happening in Bombay, it's happening in Bangalore. And if you look at the PPP website, I don't see the numbers increasing. It's around 300 plus that has been there. And some of the PPPs, as Mr. Chaudhary was pointing out, the port will have to be geography specific. So, so one really cannot complain on that. But PPP investment, if you look at, basically they are very skewed in nature, and skewed in nature where it can bring in profit for the private sector. So PPP design is very important where you serve, because public sector money is also involved. So you need to serve a social objective, as well as when private sector comes, the commercial motive and the private profit. So it is very important to do that. But at the same time, there is no alternative, because when you have a fiscal deficit which have to be controlled at 3% of GDP, government really cannot make big ticket centrally sponsored expenditure program for infrastructure, which has to come through PPP mode, but with proper regulations and proper design. And that is very important.
So, Mr. Chaudhary, is global leadership looking at short-term solutions rather than, you know, solutions like this, which are really the long-term solutions, like building infrastructure, building capacities in the developing countries? I'm talking from the developed to the developed, rather than they're looking for the short-term solution of quick access to our markets for something like that.
Quick access to our markets is something which they have always been asking for. That's a different issue altogether, whether there is a global financial crisis or not.
What's the priority?
But you have to, they have taken certain steps which are not quick, which are not short-term kind of solutions. Oma's healthcare project, for that matter, is, as Dr. Chakraborty was saying, an attempt by America to build certain facilities for their poor, which they haven't been able to address till now. British have a national health scheme which has been functioning fantastically, which is a role model for the world. We try to adopt that, we have failed in doing it, then we are running towards the American model, which the Americans say has failed, and now they are actually trying to copy elements of the NHS into their Obama's healthcare policy. Now that's not a short-term policy, that's a longer-term policy. But the shorter-term policy seems to be predominant. There is talk in America about building more railways and more roadways, which is a way of spending their way out of the crisis. But the shorter term, as we were discussing, is indeed the real theory which is happening. Eurozone crisis, banks are in trouble because Spain